Let's talk about the prices because the prices are so, as you say in your piece, the transparency is not there. But I also want to take devil's advocate and say that there's a reason why a bagel costs 50 cents at one place and it costs $3 on Madison Avenue in Manhattan.
Mhm.
And it's because of rent. And it's also because when you walk into the bagel shop in Manhattan, you're not just paying for the everything bagel that you chose, you were paying for the option of 50 other bagels you didn't buy.
Mhm.
And so the ER functions that way. We are ready for all things all the time. And so a $40 metabolic panel suddenly is actually 400 because we're really covering that. How do you, does that kind of make any sense?
No, it absolutely makes sense, except when you realize that people get the exact same care in every other developed country in the world, and it is nowhere near this cost. I actually don't think that's the root problem. I think the root problem, and I talk about it in the article, is going back to EMTALA, which was passed under Reagan in a Republican administration, which first really accelerated cost shifting because emergency departments and healthcare systems were told you've got to take care of everyone who comes in, which I think is the right thing to do with an emergency situation until you're assured that they're stabilized. But there was no mechanism to pay for it. So then it really accelerated some of this perverse cost shifting that was going on. So I'm not paying for the 50 other bagels I didn't buy. I'm paying for the 500 other people who came in who got bagels and didn't have to pay for them. That's what I that's really what accelerated the cost. And then the Affordable Care Act also said we can keep our kids on our insurance till they're 25, which I'm happy about because I've got a 20-year-old and a 19-year-old. They're happy about. It said that we have to provide additional care, which I actually agree with, but it didn't provide a mechanism to fund institutions for providing that care in most cases. So both Republicans and Democrats forced these unfunded mandates on healthcare institutions, and that caused this perverse cost shifting. What we saw after the Affordable Care Act was that most employer provided health insurance shifted over to high deductible health plans, which we can dig into if you want to, but that's another part of my scenario that really resulted in me getting this $5,000 bill, which most
Yeah.
Americans couldn't afford.
Yeah, and I really want to echo what you said about EMTALA and the Affordable Care Act. Both of these things expand access, which is really, really good. But also, both of these things have a cost and haven't always been paid for, or at least we kick the can down the road. In the
Yep.
case of EMTALA, what happens is, as you said, what half, I think you said, and that this resonates, half of patients in the ER can't afford that care. So it's the other half who are being overcharged to pay for that so that the business model stays intact. And in the case of the Affordable Care Act, it's that the cost of health insurance premiums and how much people are paying out of pocket every year has gone up to make that up. And I will never forget this. When the Affordable Care Act was being debated in DC, and I was in medical school, I asked somebody who was working on this. They were actually at HHS and I said, wait, what's going to happen when this gets too expensive? Our healthcare costs just going to become so high that people can't pay them? And this expert's answer was, "Oh, don't worry, it pays for itself." And I said, "Oh boy, that's not going to work." But hopefully, we'll be able to fix it as it comes. And I think that your example is a situation where we haven't. Um,
But can I hit on one more quick point because
yeah, yeah, yeah,
it's important at this part of the story to go back to the point that I raised in the article and that you highlighted about transparency also. So whether you're talking about the Affordable Care Act, whether you're talking about high deductible health plans, we like to pretend that healthcare is operating as a free market in this country. And if I want to go and buy a car, if I want to go and buy a washing machine, my wife and I are going to go look for a new mattress this weekend. You don't walk into the store and there's no price on anything. And they say, don't worry about it. Don't worry about it. We'll give you what you need and then we'll send you the bill in 6 weeks.
all right.
This is in no way, shape, or form a free market type of approach, but that's healthcare. And to your point, I would have gladly, if I was in that emergency room, and if I hadn't been told that I was going to get a $5,000 bill, I would have exercised my right to say, I'm going to sign out AMA. I'll relieve you of any responsibility. I'm signing out AMA because I know this is dehydration at this point, and I don't need to to stay in here and get a $5,000 bill. So the lack of transparency is a big problem here. And I say it kind of tongue in cheek in the article, but we actually, with emergency medical care for our pets, and I've been through this with my pets twice. They come in, they do a quick triage, they say, okay, it's going to cost you somewhere between this amount and this amount. Do you want this care? We've actually figured it out for pets a long time ago, and with AI and with electronic medical records, there's no reason that we couldn't come up with better systems to at least give people an approximate cost for their care if we're going to continue to pretend that this is a free market.
Yeah. And a lot of times patients will ask me, not all often, but a lot of times some of the time, patients ask me, what's this going to cost? And I say to them truthfully, I don't know. But the other thing I say to them truthfully is, I actually don't want to know because as an ER doctor looking at you, I don't want dollars and cents to actually cloud my judgment of what I think you need. And so this becomes a circular kind of reasoning of I don't want to tell you because I don't know, because I want to do the right thing for you, and therefore you don't have the option to make a choice. And so these are fighting against each other.
Yeah, they are. And you and I, we've known each other for a long time, and I greatly respect how you look at things, and I appreciate that concern. What I would say is the flip side of that concern that you have about not providing the best care for that individual is you don't see the 10 individuals who won't even come into the emergency department because they're scared of the cost. And so they are not getting any care at all. They're not getting even one iota of your great care because they're scared that if they come in, they're going to get hit with a $10,000 bill that they can't afford. And so I think we need to understand that there are many people who are denying themselves access to high quality care, even with the Affordable Care Act, because they're terrified of these surprise bills that they often end up with.
You're 100% correct. And I know this because I used to work in a city hospital where people would come in only when they had to. And the thought in your mind was, why didn't you come in like a week ago? And the answer was they weren't sick enough to risk all that. And so, or even sadder, they'd say they thought that I was going to call immigration on them because they're not documented. And
Yep.
so I have seen this, and it's tragic, and it's a situation that I think the whole system would benefit from an overhaul. And I wanted to get here later, but since the conversation has led to it now, people in the comment section of your article did say, well, wouldn't Bernie Sanders' approach be better? Wouldn't single payer be the way? And I always answer this question by saying, I don't know. I know it works in other countries, but I'm not sure this country is set up for that. What do you think about that?
Well, I think that is one way forward, and we've slowly gone in that direction with Medicaid expansion. Uh, that said, a couple things we have to remember. One of the most important things we have to remember is healthcare is 20% of our GDP in this country. And most people in the medical world think about that in terms of waste, but it's 20% of the profit that we generate in this country. And so we built a system. W. Edwards Deming said every system is perfectly designed to deliver exactly the results that it delivers. And I think we have to understand that our economic success as a nation is predicated on this market-based healthcare delivery system. So whether you want the Bernie Sanders system or not, you can't ignore the fact that if you shift there, you got to figure out how you make up for this industry that's now become 20% of our GDP. Those are
Oh
real
yeah.
jobs in people's
Good.
community. Those are real institutions. And so that's number one. But I think it's also important to understand is, and I do a lot of work in other countries, Swiss government, the Irish government, and I look at their systems. And you also can't go to a system where you're giving universal access to health care and single payer until you can agree upon what that actually means.
Yeah.
Real example. You go to Canada or the UK right now, and you'll have no shortage of people who will tell you that they're waiting 6, 8 months for their elective surgery. In the United States, you take someone who comes in to their doctor in pain or with a diagnosis, and they get told that they're going to have to wait 6 to 8 months for their elective surgery, they will lose their minds and they'll be on the phone with their lawyer or their local news station right away. And so we have a different expectation for what universal access to healthcare and a single payer system would look like here versus other countries. And until we're ready to have a very mature and nuanced conversation about that and about the fact that, hey, we can do this, but if we do this, it means that you're not going to be able to get what you want when you want, just because that's the cultural expectation here. I think there's a lot of nuance here. So at the end of the day, to answer your question, I don't think that we are quite ready as a nation to really go there, even though it sounds good. But I also think that we don't have to. Switzerland, for instance, has a system where they provide access to a certain level of care for everyone in the country. And if you want more, you can buy it off of the market. I think there's hybrid systems that we can and should be thinking about that are predicated on giving people a baseline level of care guaranteed, that do work and still allow a free market to exist.
And you're hitting on something very fundamental, which is that expanded access actually means expanded demand artificially. It means that the demand that's already there will be met. And so it's not like, oh, there's free stuff, let's go get free stuff. It's, oh, it's not going to break my whole entire financial life. Let me get this mole looked at, because it might be cancer. And so I've been living that here in Massachusetts, where we've had what you call Romney Care or Mass Health for a long time, which really was the underpinning of the Affordable Care Act. And I will tell you, we are starting to see this, exactly what you're talking about. People who are waiting months and months and months for quote unquote elective procedures, which, on a medical, on paper, you and I would say is elective. But if you ask the patient in pain, how elective is this? The answer is not very. So I think that's your point's very well taken. Let's go back.
Can I hit one more point?
Yeah.
I know we've got a lot to cover, and I love this because there's a lot to unpack in this conversation. But I am currently the director of health equity at Purdue University. I have a master's degree in public health in addition to my MD, and I feel like one of the other problems is that we tend to frame every issue when it comes to health in terms of diagnosis and treatment instead of in terms of prevention and building healthy communities. So fewer people would need knee surgeries if we actually didn't have 60 to 70% of our country obese. We would need less heart surgery if we could actually prevent hypertension with proper diet and nutrition up front. And I say that, and I think it's incredibly important because we will never be, we're in a hole and we're continuing to dig every time we look at this in terms of we need to provide care for people when they're sick, to be able to get diagnosed and treated. And every dollar we spend there is the equivalent of like spending, far more money on the front end. And the old saying, an ounce of prevention is worth, a pound of cure. If we would focus more on building healthy communities where people can exercise, where they can eat well, where they aren't in environments that are bad for their mental health and encourage substance misuse. I think that's one of the problems we have here. And when you compare us again to other developed nations, particularly European nations, people often say that we spend more per capita on healthcare than what they do. And that's true by far. We spend about 2.5 times the OECD average per capita on healthcare. So we literally don't need to spend another dime on healthcare in this country, regardless of what anyone will tell you, because we're already outspending everyone else and getting terrible results. But when you actually look at what they're spending holistically on people, on family and social support services, on again green spaces, on making sure people have access to foods and good mental health services, they actually do spend about as much money as we do on health. We just spend a disproportionate amount of our money on downstream health care. And until we solve that problem, we're never going to get out of this hole. Super quick story, but I love this story because it's true and it drives home the point. I came home one day from work and we got 2 boys, and there was water coming out of my chandelier in my dining room. And I run upstairs and I'm like, what the heck is going on? And my 2 boys had flooded the bathroom. They'd been playing with their toys and flooded the bathroom. And my first instinct was to run to the towel closet and start grabbing towels and throwing them on the floor to sop up the water. And I quickly realized I didn't have enough towels to sop up all the water. And I had to actually go to the root issue and turn off the spigot and prevent the water from flowing out of the tub. Our health care only approach is throwing towels at the water without turning off the spigot. And until we get upstream and turn off the spigot, we're going to continue having this argument over and over again.